Most of us learned at an early age that sugar was bad for your teeth, but it's not just the sugar that could be harming those pearly whites. Joining us is Dr. Terri Alani. She's a cosmetic dentist who will share with us the 7 deadly dental sins for teeth. Yes. Welcome back, Dr. Alani.
Welcome.
Oh, that music was frightening in more ways than one. Okay, so we are taught as kids, don't eat sugar, don't eat sugar, that's bad for your teeth, but there are a number of things that are. Let's start, though, with things, for example, that are sour.
Right, sugar isn't the only villain. Sour. Low pH, high acidic foods are absolutely terrible for you because of the citric acid. And we're talking about soft drinks, sour candy, fruit juices. A lot of parents don't realize this, but the citric acid is actually like battery acid when they've tested some of these sour candies. And the reason is because kids' teeth, the enamel hasn't really developed until probably 10 years after those teeth have erupted. So it can diminish tooth size, and it can also alter and cause cavities and soften the tooth. As far as sour, let's talk about sour candy for children. It has a lot of citric acid. There is a Sour Patch. This is one of them. Sometimes I'll see, like, you go to the movie theater and they have warheads or toxic waste. Why would a parent buy their child toxic
Something that's
waste?
called toxic waste.
But you can look off the back and it'll have the contents, and citric acid is usually the content. And what it does, it just basically dissolves the teeth.
Yeah.
Now,
and the other thing with these types of candies is that they're sticky. So
they're
unless
very
you're brushing your
sticky.
teeth right away, they are stuck up.
And
in
that's
that
our
tooth.
worst nightmare as dentists, is the ultra sticky, ultra sour, ultra sweet candies. Now, adults aren't off the hook either, because soft drinks also have citric acid in them. And also, besides soft drinks, there's mango altoids. That's an example, sour mango altoids. So basically what you want to do, if your child is eating these, they go to the theater, whatever, I recommend Trident gum. Trident or any sugar-free gum that has xylitol in it, which is actually antibacterial, and it actually does prevent plaque formation and keep you from having cavities. Another ingredient.
No, it's funny. My son tried to tell
really
me that,
does
and I
work.
went, "Now," he goes, "I don't have to brush, Mommy." I'm like, "No."
No,
But
it really does
Okay.
work, and also recaldent is also an ingredient that you can find in Trident gum that helps remineralize. Also, if you're going to drink these, because people do, what you want to do is you want to do it during mealtime, or you can have protein such as cheese or peanut butter or something like that within 20 minutes after you've used these.
Okay. And then with the fruit juice, too, I see a lot of people putting it in their baby bottles and stuff like that. So it just, they get used to that high sugar, that citric acid.
But just remember, it's the citric acid that causes the damage.
Okay. It can cause all kinds of things. Another type of damage that can be caused is by eating popcorn. You can break a tooth, we certainly know.
And I love popcorn, but it's the popcorn kernels. It's like eating stone. So popcorn kernels, ice. Ice is terrible for your teeth. It can cause cracks in the back. And the other thing, which as dentists we don't like, are the lip and tongue piercings. Okay? The tongue piercings, what's happening is whenever you talk, you're hitting your tooth with usually that object that's in the middle of your tongue. And it can also cause bacteria and have infections. In fact, 41% of people that have tongue or lip piercings usually have a damaged tooth or a fracture.
Wow. Okay. We have our training toothpaste here. Of course, one of the things that we need to do with kids is get them in the habit early of brushing their teeth effectively and for enough time. But you can start out at, in fact, when I had my son, the doctor said, start him with even just massaging his gums.
The reason I brought that is it has to do with fluoride. There is a abnormality called fluorosis that can exist in people's teeth, and usually it doesn't affect you unless you're 8 or under when the teeth are developing, but it's caused from 2 things. Either too much fluoride in the water,
so you can get too
which
much.
You find in people that grew up in West Texas, and it can go from light spots to intrinsic yellow-brown staining. And some of it is also caused by children before they're aware of spitting out the toothpaste, they swallow it, and it has too much fluoride. And so I would recommend a training toothpaste that does not have fluoride in it for these children. There are a lot of ways to correct fluorosis. You can do the whitening. There's also microabrasion, which is this, it's a pumice type of material that we actually use in the dental office to get rid of that stain, or veneers.
Okay. The other thing is, we teach you to brush your teeth in the morning, brush your teeth when you go to bed, and then a lot of times kids have a snack after they brush their teeth, or go to bed with a glass of milk. So you go into bed with a glass of milk. Is that damaging to your teeth as well?
Yes, it has sugar in it. Have you seen how much sugar milk has in it? Absolutely. What you want to do is you brush your teeth, and that's it. Bedtime.
Yeah. Okay. You can lose your teeth at any age. We always associate that with, you know, the 5, 6, 7-year-olds, but you can lose your teeth actually at any age.
Now, you're supposed to have 32 teeth, but some people actually have congenitally missing teeth, which they're not aware of. For instance, the teeth that are next to your 2 front teeth, your lateral incisors, some people actually congenitally are missing those. So you can replace that with an implant or bridge or what have you, and not everyone gets all 4 wisdom teeth. Yeah. You start to see that mutation as generations have gone. But the worst type of tooth loss is from gum disease.
Yeah, which 4 out of 5 people
4 out
suffer?
of 5 Americans have gum disease, ranging from gingivitis to extreme periodontal disease.
Yeah, and that's why maintenance is so important, because we're basically outliving our teeth, so we have to help them out a little. All right, Dr. Alani, thank you very much, ma'am. If you need a dentist or want to learn more about your teeth, you can call Dr. Terri Alani at 713-621-5141, 713-621-5141, or you can head to, I love this website, TexasToothLady.com, TexasToothLady.com.